Back pain is a huge problem in the United States. Not only just how much it costs to take care of patients who are suffering from back ailments, and this includes the neck as well as the low back, but also in lost work productivity. Lots of people miss work because of recurrent back pain and neck pain. It's a very common ailment, and it's going to affect pretty much everyone at some point in their life. And a way to kind of limit the amount of back pain that you have to deal with are kind of twofold. One is, preventative, what you're doing at home and in your lifestyle, such as maintaining a healthy body weight is critical. Getting exercise is really important. It helps to strengthen the core muscles. Walking is excellent. Things like Pilates are really good. Yoga, lightweight activities, very good for core strengthening. And then also not smoking. People don't realize that smoking is a big cause of degeneration of the disc in the spine, and will really exacerbate an underlying problem there. And at work, you can prevent bouts of just the common backache and back pain by doing a few simple things, which involve mainly making sure that your workstation is what we call ergonomic, which means not in a position of bending forward and looking at a keyboard all day long. Making sure that you're not slumping in your desk, but having a good erect posture when you're sitting in a chair, and also taking breaks periodically, and say every 30 minutes, you just get up and stretch your spine, turn side to side, move your feet, are really good, and also stretching of the neck are good ways to kind of avoid or ward off back pain brought by sitting at desk. Is really sitting in the sedentary lifestyle is harmful, to the spine, because it basically results in weakness of the supporting muscles of the area, and just bring about a musculoskeletal type of pain. The important thing is there are some warning signs, and in general, if the pain doesn't get better within a few days of rest and using over-the-counter analgesics, or tends to be getting worse, that's something that probably you should talk to your primary care doctor about. If it's associated with any kind of neurological symptoms, and these are things like numbness or weakness in an arm or a leg, trouble walking, trouble controlling the bowel and bladder function, particularly associated with back pain or pain shooting down the arms or down the legs, that can be a sign of a nerve being impinged upon and should be worked up.